Welcome back to Midday Live. We are joined by Mary Jo Hughes and Stephanie Lape from the VA Western Colorado Healthcare System. How are y'all?
Doing great.
We're
thanks.
great. Thank you for having us.
Of course, thank you for coming today. We're talking about something very important, the palliative care system. So first, explain to me really what this system or what this program is.
VA palliative care has been around for 15 years. Nationally, the VA made a big decision to develop palliative care teams at every VA across the nation. So we've been in existence here in Grand Junction for 15 years. Initially, we focused our efforts on providing excellent inpatient palliative care services. In the last few years, our goal has been to expand outpatient services so that we can serve as many veterans as possible. We are in a position now that we will be fully staffed. We're adding another nurse practitioner and another RN, so we're very excited to be able to continue to expand our outpatient services.
Yeah, so we know what the program is. Now tell me, who would find this specific care beneficial?
Right, so you might even ask, what is palliative care? And palliative care is extra support for veterans and their loved ones experiencing serious illness. And palliative care really likes to think of a veteran as a whole person, mind, body, spirit. So as Mary Jo was mentioning, we have physicians and nurses on the team, but also a psychologist, a pharmacist, a chaplain, and a social worker. And you know, palliative care can see veterans in the inpatient setting, so like if they're admitted to the hospital, but also Mary Jo was mentioning we're expanding the outpatient setting so we can see veterans face-to-face in the clinic, but also via telehealth, VA Video Connect, and just over the telephone, really whatever is best for veterans. And I think you asked who would benefit or you know, who should look into palliative care. And really any veteran experiencing serious illness, and you know, that can include things like heart disease, lung disease like COPD, neurologic conditions like ALS or Parkinson's, dementias, and of course veterans living with cancer. And really anybody who's looking to maximize quality of life.
Yeah, absolutely. It's very, very important. Now, I feel like you kind of maybe touched on this a little bit, but tell me a little bit about some of these services that are available.
Yeah.
So we offer an initial consultation where we have our multidisciplinary team, depending on what the veteran's needs are. And the goal of this is really to get to know the veteran, their loved ones if they choose to bring them. What is important to that veteran? We like to find out who is the veteran, what concerns they might have about their present disease or the future. We like to know what is important to them on a day-to-day basis and then looking towards the future. We also talk about how can we be the most helpful. We want to know what are their worries, what are they struggling with, what kind of services we might be able to look at to put in place to help them to achieve those goals. We also meet with the medical power of attorney if that veteran does not have medical decision-making capacity. So all of our services can be offered to veterans' families also, depending on the needs of that veteran.
Yeah, absolutely. Now, all of this is great, but we need to know how to apply. So how do we apply?
Right. Really, all you have to do, all a veteran or a family member has to do is ask about palliative care. So a veteran who's seeing their VA primary care provider could ask about a palliative care consult. If they're seeing a VA specialty care provider, like a lung specialist or a kidney specialist. And certainly we have veterans who are seeing lots of providers out in the community. If they're seeing oncology providers in the community, we get referrals as well from community providers for palliative care. We also see, I really want to emphasize, we have a huge catchment area. So we have veterans living in Gunnison, in Moab, in Montrose that all are served by the VA Western Colorado. Wow. And so we can see people, in creative ways, telehealth, VA Video Connect. So we want to, not just here in Grand Junction, but also the entire service area.
Yeah, the Western Slope.
Yeah, absolutely.
Well, it's also very important, the phone number, and we have that as well, the 970-263-6297. Call that, and y'all will be there to answer the phone call. Well, thank you so much for joining me today. We appreciate it. It's very, very important for what you do because there are a lot of veterans right here on the Western Slope and around, this area.
Absolutely, yes.
Yes.
All right, thank y'all so much.
Thank you.
We'll be right back after this.